Hello, these exercises have been designed for you to serve as an adjunct to your physical therapy program. Once instructed and cleared by your therapist, you may begin these exercises. Your therapist will instruct you on how many sets and repetitions you are to perform, as well as any special precautions you are to adhere to. If you have any difficulty understanding or completing these exercises, stop and consult with your therapist. Active assisted range of motion. This is when the patient has some strength but needs assistance to complete the full range of motion. The key here is to provide the patient with the least amount of help that he or she needs. You will be assisting the patient with these exercises, so you want to pay close attention to your body mechanics. Try to keep your feet apart, knees a bit bent, back straight, and adjust the table or bed height as able in order to prevent excessive bending or stooping. This is all to prevent self-injury. Ankle pumps. Start by holding the patient's foot by cupping their heel with one hand, allowing their foot to rest on your forearm. Place your other hand on top of their foot and begin to assist them in moving their foot up and down in a pumping motion. Move your body with the patient. This exercise helps to maintain strength and mobility at the ankle, and it also helps to prevent blood clots. Hip and knee flexion. To begin, support the patient's leg with one hand underneath their foot and the other hand underneath their knee, and begin to assist them in bending their knee and hip toward their chest and back to start position. Pay attention to the alignment. Try to keep their foot in line with their knee, in line with their hip. This exercise helps maintain strength and mobility at the hip and the knee. Make sure you're moving your body with the patient. Hip abduction, adduction. To begin, support the patient's leg with one hand underneath their foot and the other hand underneath their knee. Begin to assist them in moving their leg out to the side and back in, attempting to cross midline. Move slowly and controlled. Move your body with the patient. This exercise helps to maintain strength and mobility at the hip. Hip abduction is moving the leg away from midline. Adduction is moving the leg toward midline. Abduction, adduction. Straight leg raise. To begin, assist patient in bending their opposite leg. Assist them in keeping their legs straight with toes pointed up. And begin to assist them in lifting their leg up and down, slow and controlled. Have them attempt to hold for 1 to 2 seconds and lower slowly, and avoid lifting their leg higher than their opposite knee. Encourage them to keep their thigh muscle tight to emphasize keeping their knee straight. This exercise helps to strengthen the hip and the knee, as well as maintain mobility at the hip and the knee. And can also work the abdominal muscles as well if you're encouraging the patient to try to keep their abdominal muscles tight as they're slowly lifting and lowering their leg. Keeping their opposite knee bent helps take some pressure and strain off the lower back. Make sure you move your body with the patient, slow and controlled. Short arc quad. To begin, place a small towel roll underneath the patient's knee. Support their leg with one hand underneath their foot and the other hand resting on top of their knee. Begin to assist them in slowly lifting their leg from their knee down, attempting to hold for 1 to 2 seconds, and lowering slowly. Keeping your other hand resting on their knee helps to remind them to keep their knee down on the towel roll and avoid lifting their thigh. And it also can help to facilitate the quad muscle to work. This exercise helps to maintain strength and mobility at the knee. Move your body with the patient. Move slow and controlled.